I think that everybody should have the same quality of health if you've got £1 million or you've got £10 million or you've got £5. And if we can actually get more people talking about it, involved in it, we can actually have an A1 service that rivals any other service in the world, which I already think it probably does do.
What gives me determination is seeing the difference that it makes to people's lives.
Having that drive to make things better for the patients that we see is absolutely paramount.
The thing that gives me the most determination is seeing the changes to services and feeling that we can benefit the population, help people to live longer and healthier lives, and when they do need healthcare, to make sure it's the best that it can be and they are treated with dignity and respect throughout that process.
I've been a nurse for 31 years. I'm absolutely passionate about providing the best quality care that I can for the residents of Newark and Sherwood.
I like to go out to hard to reach groups. I like to help people to access and improve their lives and get the best out of their life.
I know as a young GP with not much experience, I used to get very frustrated. Why couldn't something be changed? Why couldn't something be done in a better way? Why do my patients have to wait, or there's a much better way of doing it? And the only way that you can get involved to make those changes happen is having that very active clinical engagement for the CCG.
I'm absolutely passionate about patient care. I'm a nurse at heart and always will be, and I think we owe it to our NHS to make it the best it can be and sustain that so it's the highest quality in the world. And I want things to be right for me when I'm an old lady, and I want things to be right for my family and the generations to follow.
And I know that without investment and support in preventing ill health, that long-term health outcomes will be profound, and putting that passion and commitment in the early intervention and support and prevention is going to have long-term value and benefit.
I think fundamentally at the centre of clinical commissioning groups is a very active stakeholder group, and we know that actually taking forward the mantra of no decision about me without me, we absolutely must make sure that our patients and our public are fully on board with us. We need to listen to their views, and we need to make sure that their views are taken into account, and also we're including the patients and the public in the decision making processes.
Our local population have told us that there is inconsistency in the services that are offered in their GP practices and in their own homes. We want to ensure that everybody has the access to the same quality services across Newark and Sherwood.
We have Gypsy and Traveller population, we have Eastern European population, we have lots of young mums in our population, people with disabilities and learning difficulties, and lots of older people obviously that will need services in the future.
One size doesn't fit all with healthcare, and we need to be very much focused on the locality and what's available locally, but also the personalities within our local community. This has been our first year as an autonomous and responsible organisation for healthcare within Newark and Sherwood. That's meant that we've been able to up the pace in terms of helping to plan our strategic direction over the next 5 years. We've been working very hard on the Better Together Mid-Not Transformation programme with our colleagues across at the Mansfield Nashfield CCG, and we've been given lots more scope in order to improve quality and start to plan services for the future.
I think it's always important to be looking at best evidence and trying to test out new ideas so that we can grow all the time. So we work in a cycle of continuous improvement.
We provide face-to-face consultations both at Newark Hospital and a home visiting service as well.
We've been talking about how we can extend opening access to GPs, and we've been looking at various models that we can do this with, and we've had a number of patients in with us today telling us what's good and what's bad and how we can improve things for patients.
And moving forward, we'll be looking at assertively in-reaching patients from hospital and utilising the skills within the team to facilitate early discharge. We're just striving to push it forward just to help the community as much as we can.
I think the changes that I've seen over the last 7 years as a community matron, my role has evolved in that time and has continued to evolve, and I can see that we're making a real difference for people. Every day is different. Every role that we kind of introduce into the integrated care team brings with it some new experiences and adds to our breadth of knowledge, and just being able to achieve the best care for patients keeps me excited.
In terms of the way we discuss things, we start off often on a big scale and try and get as many voices and opinions as possible. So it helps to guide us and support us ourselves through that whole route. We then obviously need to take home and take on board all those elements, but also look at them in a context of where we are as a commissioning group and what our responsibilities are. I think within any element of healthcare redesign or service that we provide, the patient is the priority. It's vital that we include the patient in all aspects of discussion and service redesign.
It makes sense to communicate with your customers. I mean, let's face it, the patients are the GP's customers. So if you want to find out what it is they want, then you can deliver a better service to them.
Quite often patients are scared at saying something because they think it might affect their patient care. I would say no, definitely not. We can actually take it anonymously and pass it through to the relevant authority. That's not going to affect their care, and it's best if we know, because then we can change things for other patients. We want to know from patients what's actually happening out there, so we want to know their experience.
And if you want to know how a service really works, or even better, if you want to know what doesn't work about a service, you won't find it in a policy document, you'll find it in a conversation with service users.
Communication's the key. It's the key to quality and safety and patient care, and the only way you have that really is through face-to-face contacts. We can do as many bulletins and newsletters, but actually nothing beats being there on the front line, being visible, being accessible to people, to answer their questions, to observe their practice and to support them really where they need it.
If the local population and the communities don't believe in what's happening and don't own the plans and the strategies of the CCG, then it won't be delivered. Patients have really got to be engaged in their care so that they can do more for themselves where it's appropriate, and that they get fast and appropriate care in hospital when they require that.
But for me, what I'd like is the community to be involved, to have a voice, but also to be able to engage with people who are at low risk, recently been diagnosed with the condition, so we can give them that boost of morale and confidence at an earlier stage, which will be longer lasting.
So it's really important that they build from the bottom with patients and with the workforce their plans. That way they'll sustain what they're putting in place now.
I think it's important for the CCG to support networking between GP practices and other health professionals, because they basically then are helping the spread of information about what services are out there.
And there's nothing worse than organisations that work in silos. So good team working, cross-culture, cross-organisational communication is key really.
We're at an interesting point in time in health and social care. Never has it been more important that we use the public purse wisely, but also it's important that we offer the best quality care for our patients. It's also important that we acknowledge that we all have a part to play, whether we be ground staff, clinical staff, meeting with patients, or the patients themselves.
Our responsibility is to plan services that meet the needs of the local people, and so therefore we have to understand what local people do think about services and what they would like to see in order to inform our plans and how we actually ask the providers to deliver the services.
We all access healthcare at some point in our lives, and actually being involved in planning it and developing it is our opportunity to make services right for us.
And we would really encourage people to go onto our website. They can put comments in through that. We have a PALS service again through the website, or a phone number. We would really encourage people to come to events. We have a rolling programme of public events, regular events that people can come to, and also they can email through to the CCG with any suggestions or comments.
Don't be afraid to talk to anybody within the health service who you engage with.
I think the most important thing is to get involved. If you notice that there's something that you think can be changed, let us know and we can look at changing it.
If you don't get involved, your voice won't be heard, and it is important that your voice is heard. So my message to you is get involved.